Bismillahirrahmanirrahim, and welcome back to this next video. And this is the 7th video in the series of videos on immunology. In my previous video, I told you that researchers in the early 1900s they characterized certain components of the serum, and they were calling them as the antitoxin, precipitin, and the agglutinin. Now, initially they were thinking that different components of the serum are responsible for these activities, but after careful inspection by other researchers, they identified that the soluble active component in the serum that is responsible for agglutination, precipitation, or that work as an antitoxin, they were the antibodies. And I've told you that these results they led to the idea of the anti-serum. Now, in this particular video, I want to focus on the anti-serum and some of its applications. Now, the first thing is, what is an anti-serum? Now, if you define this anti-serum, so this anti-serum is a blood serum that contains antibodies that are specific to a particular antigen or pathogen. Now, how you are going to produce these antiserum? So these antiserum are produced by injecting a person or animal with a particular antigen, such as a particular virus or bacteria. Now, after the injection, this virus or bacteria, it stimulates the immune system to produce specific antibodies against the selected virus or bacteria. Now, these antibodies, they are collected from the blood serum of the animal or the person injected with a particular virus or bacteria, and they are purified to create the antiserum. So this antiserum is going to contain the antibodies specific to the viruses or bacteria that you are interested in. Now, what are the important applications of this antiserum? How these antiserum are helpful in treating the disease conditions in patients? Now, in this particular video, I'm going to give you two examples, one of the tetanus and the other one of the rabies, and I'll give you more examples in my coming video. Now, when you talk about the tetanus, also commonly known as the lockjaw disease, this is actually caused by a bacterium known as the Clostridium tetani. Now, this Clostridium tetani, it can enter into the wound or any cut in the skin. So if your wound or cut come in contact with a contaminated object with Clostridium tetani, so this bacteria is going to enter into the body. Now, when this bacteria enters into the body, that is going to produce a neurotoxin, which is generally known as the tetanus neurotoxin. If you specifically talk about the neurotoxin produced by the Clostridium tetani, this is known as the Tetanus spasmin. This tetanus spasmin is a protein with a molecular weight of 150 kilodalton, and this toxin is going to inhibit the GABA neurotransmitter. This is gamma aminobutyric acid. Now, this gamma aminobutyric acid or GABA neurotransmitter is very important for the normal contraction and relaxation of the muscles. And when the tetanus spasmin that inhibit the GABA neurotransmitter, it results in severe hyperextension and spasticity in the muscles. If you talk about the symptoms of the tetanus, the major symptoms include the muscle spasm and rigidity, the trismus, the lockjaw, and this is one of the most common symptoms that you see in the tetanus. Therefore, this tetanus is also known as the lockjaw disease. There are problems in the respiratory system, and all of these combined problem lead to the death of the patient if not properly treated. So how are you going to treat this tetanus with the antiserum? Now, the antiserum available in the market for the treatment of the tetanus, that is known as the anti-tetanus immunoglobulin, the tetanus immunoglobulin, or the tetanus antitoxin. So all of these three things, they refer to one and the same thing. That is that this anti-tetanus immunoglobulin or the tetanus immunoglobulin or the tetanus antitoxin is actually a medication or an anti-serum that contain antibodies against the tetanus toxin. So in this particular case, you can say that these immunoglobulins are going to stop the function of the tetanus pathway, thereby allowing the GABA neurotransmitter to function and hence the normal relaxation of the muscles. Now these are some of the examples of the you can say commercially available human tetanus immunoglobulin in the market, which you can use to treat the tetanus condition. Another important disease that you can treat with the anti-serum is known as the rabies. Now this rabies is caused by a virus known as the rabies virus, and this rabies virus is an enveloped single-stranded RNA virus with a bullet shaped or rod shaped, and this belongs to the genus Lyssavirus. Now this is the structure of the rabies virus. I am not going into the detail of the structure of the rabies virus because this is not the scope of this video, as I am focusing on the importance of the anti-serum. Now what happens is that this rabies, if you talk about this disease, is a preventable viral disease, and this rabies is most often transmitted through the bite of rabid animals. Most commonly the dogs, the rabid dog is one of the major causes of the transfer of rabies to the human beings, because most of the time we are in contact with dogs. Now if you talk about the symptoms of the rabies, so the first symptoms, they may be similar to the flu, like there are weakness or discomfort, fever or headache, and these symptoms and these first symptoms are actually followed by serious symptoms including the cerebral dysfunction, anxiety, confusion, and if not treated, it can lead to the death of the patient. Now this rabies virus, how it is going to affect, how it is going to kill the individual. Now this rabies virus, it actually modifies the host behavior. It contains a snake-like toxin region of its glycoprotein, and this glycoprotein, what it do is, it is going to block the neurotransmitter receptors in the central nervous system of the patient. Now if these neurotransmitter receptors, they are blocked, that would mean that the central nervous system is not going to function properly, because the neurotransmitter will not be able to interact with their respective receptors, thereby leading to the dysfunction of the central nervous system and causing cerebral dysfunction. How you can treat this rabies? Just like the tetanus, human rabies immunoglobulin, which is an anti-serum that is used to treat the patient of the rabies. Now this HRIG is administered only once at the beginning of the anti-rabies prophylaxis to previously unvaccinated persons. The vaccinated persons, most of the time, they are good enough to tackle the conditions. But on the safe side, this HRIG, it is also injected to the vaccinated as well as the unvaccinated individuals. Now, this HRIG, as I told you, this is an anti-serum. It is going to contain the antibodies against the toxin produced by the rabies virus. So this HRIG, it provides immediate antibodies until the body produces its own antibody to tackle the condition of the rabies. Now these are some of the commercially available human rabies immunoglobulin in the market, and you can use them to treat the rabies condition. So if you like the video, please subscribe to my channel, hit the notification bell so that you can receive the notification for other videos in the series, and do share it with your friends. In my next video, I'll give you some more examples of the anti-serum, because this world of the anti-serum, this is preventing many deaths in the world.